Hello, everyone. It's my pleasure yet again to interview another merit list topper, and that is Dr. Mansi Saraf. She secured AML rank 5 in the recently conducted INISS. Congratulations, Dr. Mansi. How do you feel?
Thank you, ma'am. Ma'am, mostly I'm relieved, ma'am.
Yes, I'm sure you are. Because, so how long has your preparation been?
Ma'am, actually, I underwent the last year October exam, and
Okay.
till that I was thinking that INI is something way too much, and I couldn't do that. So for the November December, when the results came out, when I watched the recall videos, then I felt that it is doable.
Doable.
So yes, and then I gathered and planned, and I began by January this year only.
Okay. So you've done your MBBS, NMS both from NSAB Medical College, Jabalpur, right?
Yes,
Okay. And so when did you decide that you wanted to become a plastic surgeon and you started preparing?
ma'am, it was right in my second year of MS.
Oh, okay. So, and you stood firm on your decision, no wavering here and there, no gastro,
No,
onco, or anything
no,
like that.
no.
Okay. And what interested you most in plastic surgery?
Ma'am, actually, here we have very much exposure to plastic surgery in our
Yeah,
department.
it's a very
So,
good department. Yeah.
yes, ma'am. So, mostly I get to see that brachial plexus injuries, and that used to fascinate me
Oh,
like anything. So,
oh.
and consultants are very keen into doing varieties of stuff, right from rhinoplasty
Hmm,
to flaps
hmm,
and then to brachial
hmm,
plexus nerve transfers. So,
hmm,
I
hmm,
was amazed with the post-op results. So, that actually fascinated me way too much.
hmm. And so, did you have exposure to plastic surgery during your MS as well?
Yes, ma'am. Almost we had around 9 months of total, 8 to 9 months of total rotation in the plastic surgery unit.
9 months.
In
Oh, that's a
yes,
huge
ma'am.
leap in MS.
Yes, ma'am.
Oh, and what about the
We
other super specialties? You have rotations in others as well?
Yes, ma'am. We had in other specialities as well, but due to COVID pandemic that time, we
Ah,
had almost 3 to 6 months of rotation in other units. But the plastic was
okay.
uh, exposed too much to us.
Maximum.
So
Okay, okay. So that further, you resolved that you wanted to become a
yes,
plastic
ma'am.
surgeon. Okay, that's great. And when did you start your preparation?
Ma'am, initially it took me around a month to figure out what to read, what not to read, then which book to refer to, and how to actually go on with the planning. So
Hmm.
I roughly began by 15th of December, and initially I couldn't do much due to my postings and all. So
Hmm.
strictly I started with January only. That was my New Year
So
resolution.
you said you finished in June 2023.
Yes.
So, and what did you do for the rest of the 6 months of the last year?
Ma'am, currently I'm doing senior residency in plastic surgery unit since last 8 months.
There only, right?
There, yes, ma'am, here only.
Oh, so I mean, it must have all, further added to the preparation that you already
Yes,
were
ma'am.
doing, right?
Yes, ma'am.
Okay, that's great. And do you think that it really helped you working in a plastic surgery unit?
Yes, ma'am. It was very much helpful, way too much in that interview session, because
Hmm.
everybody used to ask me only two questions in the beginning, that where are you working and what all you are exposed to in that
Hmm.
duration of your tenure.
Hmm.
So
Hmm.
from that question only, my further questions used to come up. And
Hmm.
almost everybody used to ask me practical aspects of plastic surgery. There was no
Hmm.
theoretical questions, and
Hmm.
nobody asked me anything about classifications or something. Everybody was used to ask that how will you plan this patient, what all precautions you'll
Hmm.
take,
Yeah.
like that.
Hmm. Approach
So it was
basically
definitely
rather than
yes,
theory. Hmm.
yes.
So
So
the
definitely
October INISS you did qualify, right? The first
no,
round you
ma'am, I
said you
couldn't
qualified.
qualify.
Oh, you didn't qualify that. Okay.
Yes,
And so this was actually this was your second attempt at the INISS.
yes.
Okay, okay. So, and what do you think helped you most in the preparation? I mean, how did you plan, and what books you referred to, what resource you went to? How much was Marrow helpful?
Ma'am, actually, our consultants are very much fond of teaching. So I started with reading GRAPS topics, and I used to read it. It is very I found it very easy to
Yeah,
understand.
easy to
But
understand. Yeah.
at the same time, it is not a book we should refer to at the end of the day for MCQ examination. So what I did was used to read GRAPS, and some points were not that easy to understand. So I used to watch Marrow videos, and that was very much helpful to understand every bit of a topic. And almost every topic was intensively covered, even the minute ones. So I used to watch Marrow videos, and then I used to add the points in Michigan manual. So at
Hmm.
the end of the day, I had my Michigan manual that I used as a Bible. That I'll
Hmm.
be reading this only at the end of my first reading. So
Hmm.
Michigan was the whole of the book, which I had.
Yeah, so you added everything like notes
Yes,
in
ma'am.
that. I think last year or maybe last to last year, I was interviewing another topper, and she also told me the same thing that she added
Ma'am, actually,
everything in
I've referred
Michigan.
to your interviews only for that, and many
Okay, yeah,
have referred to Michigan manual and keynotes. So I found
yeah,
Michigan quite better because it has diagrams and all. Keynotes is
yeah.
quite black and white, so that was
Yeah,
not
yeah.
catchy.
Keynotes actually,
So
it's a very old resource also. We used
yes,
to refer
ma'am.
at our times as well, almost like, I'm talking about what, like almost 13, 14 years back. And it stayed
Yes,
the same. But Michigan
yes,
Manual is always updated, and also obviously that is more interesting. And the topics
yes,
also are covered in a more, I would say, organized way in Michigan
yes,
Manual.
ma'am.
So and yeah, so I when I was making my notes for Marrow and my lectures, I almost used all these resources like Grabs and Smith and Michigan
Yeah,
Manual as well as keynotes, and I tried to make it a summary of all of it. But there's so much to teach that again you feel that if you give too much
yes, ma'am.
information, that's also confusing.
Way too much
So
for at us.
yeah, way too much for starters because I think lucidity is very important for
Yes, ma'am.
somebody to get hooked to a subject. Otherwise,
Yes, ma'am.
if it is not lucid, then you lose interest if
Yes,
it
ma'am.
becomes too difficult. So what procedures? You said brachial plexus. What other things did you see in the department mostly?
Uh, Ma'am, here we see almost everything, right from grafting to local flaps, free flaps, many transpositional flaps, rotational flaps, and
Hmm.
the rhinoplasties. Few we do here. Brachial plexus we do
Hmm.
almost every week. There is
Oh.
way too much exposure to brachial plexus here, and
Hmm.
then pediatric cases like cleft lip palates, syndactyles,
Palate,
and
yeah. Yeah.
other post-bone reconstructive options.
Hmm.
So there is
So,
wider range of surgeries here.
yeah, lot of exposure, I would say. And
Yes,
so you said you started preparing in December, and
yes.
so you went back to the videos, and or you kept adding everything to the Michigan manual, you said. And in the last few, let's say, months, couple of months, how did you organize yourself? Did you sort out the topics that you will read only these topics, or how did you do it?
Ma'am, actually, your videos was the actually the summary of GRAPS, Michigan, and
Hmm.
I think a better way to for us to understand since it was very it was explained in a very easy way for
Hmm.
any beginner to get to know the topic very well.
Hmm.
So I used to get hold of that topic by watching your videos only, and then only one or two points were left to add in the
Hmm.
Michigan.
Hmm.
So at the end, in the last 2 months, right in the March and April, I used to revise
Hmm.
Michigan only, and I used to
Okay.
solve MCQs and
Hmm.
the grand test. And
Hmm.
whatsoever
Hmm.
that was not included in that chapter, and I used to
Hmm.
bookmark it and I write it.
Okay, okay. So a very organized way, I must say, that you
Yes,
followed, and because at the last we get so confused. Okay, what to read, what to leave, so that becomes kind of a lot of confusing, state at the last moment. So I think that was a very smart way to, concise and prepare for the
yes, ma'am.
entrance. What were you asked in your the second stage?
Ma'am, the second stage was very extensive. There was 6 stations, and
Hmm.
it was like for 5 to 10 minutes at each station.
Hmm.
So they used to begin with these two questions that how what all cases you have seen, and then
Hmm.
they asked me gastrocnemius, mostly gastrocnemius muscle flaps was extensively asked at 2 or 3 stations. Then
Okay.
the management of leg
Oh,
defect.
2 or 3 stations. They asked gastronomist muscle flap.
Yes, ma'am.
Oh, that's quite unexpected. That the
Yes,
same
ma'am.
question at 2 or 3. Okay. So were
And
you prepared for this question?
yes, ma'am.
Okay,
Ma'am, the mock
wonderful.
session
Great.
was actually very helpful.
Okay.
Then, ma'am, there was extensive discussion on the defects of leg, upper, middle, and lower one third. And
Hmm.
cleft lip palate, they have asked, how will you proceed?
Hmm.
Then
Hmm.
there was, since I had some exposure about brachial plexus, so almost at the end of 4 stations,
Hmm.
they turned down to brachial plexus management.
Hmm.
So the basics of it as well.
Hmm.
And
Yeah.
then Mathis and Nahi classification, they have asked me. And
Hmm.
some lip repairs, lip reconstruction, and ear reconstruction was asked at one station.
Hmm.
And grafting, the uptake of graft was asked. And what will you do if the graft is failing and the flap is failing?
Hmm.
This
Hmm.
was the questions. And one station has asked me syndactyly and Gillies principle of plastic surgery was asked. Though I couldn't
Okay.
answer that question, but
Hmm. 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 Hmm.
it was asked.
Hmm. Hmm. Hmm.
So
Okay.
these are,
So, okay. So, I mean, were you also asked to make some PPT and all, and a day
yes,
before
ma'am.
the exam? And but you were
Yes, ma'am.
not asked based upon that any questions?
No, ma'am. They
No.
only HOD sir has asked me since we have recently started here skin banking. So
Hmm.
sir has asked me a few questions about skin banking, how you take
Skin
and how you
banking.
proceed with that.
Okay, okay, that's great. So I think you had quite an extensive viva, right? From graft, flap, ear, lip, brachial plexus. I'm sure you must be very delighted at those questions because you were fully prepared
Yes,
for
ma'am.
brachial plexus. And I think that's a trick that, whatever topic you have to veer the questions towards that. And gastrocnemius muscle flap. So yeah, you had a lot of variety in your viva, I think. And great. I think you've done very well to secure rank 5 with all these tough questions directed to you. So
Thank you, ma'am.
now I would like to know from you that if somebody is wanting to pursue plastic surgery, then what would you recommend them to start? When do they start preparing according to you? When is the right time?
Ma'am, firstly, I'd recommend that it is doable. There is nothing we
Hmm.
should be afraid of. One thing, and this other thing, I think, is 6 months enough time for
Hmm.
preparation, because almost in the first month we have to dedicate our time for the proper management and execution, that how will we
Hmm.
proceed, what all materials we need to have, and from where
Hmm.
we will refer. So I
Hmm.
guess 15 to 20 days is usually required for that management. And
Hmm.
after that, in the initial days we go on with some slow pace. So
Hmm.
I think at least 1.5 to 2 months should be there for the first reading. That should
Hmm.
be done extensively, and every
Hmm.
topic should be done cover to cover. And then
Hmm.
in the last 2 months I could revise 4 times only,
Hmm.
though I planned to go
Okay.
5, but I couldn't do so. So I think
Oh,
three
that's
to four revisions would be enough with all the Marrow grant test and question banks. I think that is enough.
right. And did you attend the Zoom session that we did before the
Yes,
stage two
ma'am.
preparation? You did. And
Yes,
you
ma'am.
think it helped?
Yes, ma'am. Ma'am, the first question thrown to me during interview at the first interview was the Nagpur classification of cleft lip. And
Huh.
before that, I have never read that in Michigan since it is not written. Only you
Yeah.
told us to read that since it is ours. So
Yeah.
I was quite happy that, okay, I know something.
Yeah. As I said, cleft lip and palate, they will ask anything. So
Yes,
just like, you have to be thorough with everything in cleft lip and palate. You just can't let a small topic also you can't leave behind. So because cleft lip and
yes,
palate is a huge part of plastic surgery residency. So definitely. So I'm so glad that you found the videos useful and that you based your preparation on that. And I feel so happy to interview candidates like you who done so well in their exams, and it keeps me motivated to keep recording lectures and keep updating. So it's been really nice talking to you, Mansi. And so what now? How will you spend your remaining free days before you join?
I'm very much relieved, and I'm trying to enjoy every bit of the time I have.
Yeah,
So
I'm sure.
yes, ma'am.
Great. So very nice. And so what do you think? Which institute are you going to opt for?
Oh, mostly since Ames Delhi has only 2 seats, so probably I might get PGI only.
PGI. Okay. How many seats does PGI have this year?
3, ma'am.
Three. Okay. Yeah, yeah. So all right. So yes, great. So enjoy your time and lot of good wishes. Congratulations from Team Marrow, and
Thank you, ma'am.
stay dedicated, and we'll surely meet sometime
Yes,
around.
ma'am. Yes,
All
ma'am.
right, Mansi. Thank you for talking to us.
Thank you, ma'am.
Thank you. Bye bye.